All right. Just completed the assessment, the initial assessment. Again, it's just a tool you can use, modify it. It works for you. You practice it, you get really good at it, and easily do it in 30 minutes. Okay. And it is a lot, but again, it's the idea we are giving high quality, valuable information to our clients. Okay. They're not just coming in, puking, and sharing their story and really reinforcing a lot of negative emotion they have about their partner, about each other. So just getting the heart of the issue, uh, not wasting their time or mine or their money. And usually too, I do this for free. The initial appointment is free. And a lot of times I will spend hundreds, if not into $1,000 or more in someone's recovery, or a couple of my time before they'll even invest a dollar towards their own recovery. So I find that beneficial to give more than I receive and try to outgive, but generally you reap what you sow, and I'm tremendously blessed. So session 10 here, we are just going to do a quick review. Okay, so we're going to go back through the assessment and the 20 areas, okay, that are on that sheet you have. We got through most of them, but I held off on the last three, 17, 18, 19, 20, maybe the last four before, for good reason. I'll explain. So but as we go through this, so area number one is we're looking at the psychological or the family stuff, family of origin, nature, nurture. You can even do a genogram, family tree for those of you that know how to do that. I do genograms, especially for my younger clients, my teen clients. Seems to be more helpful, and you have a little more time because their history is a lot shorter. And so their answers are a lot quicker. Okay. So if you're into genograms, that can be helpful as well. And two is the biological piece, the sex addiction, the love addiction, the chemicals of, again, the oxytocin, dopamine dump we talked about in level one. And looking at that, is there OCD, obsessive compulsive history, porn, masturbation, ring the bell, feed the dog type of stuff. Okay, classical conditioning stuff. Okay. So we're looking at first the psychological, family stuff, the biological, what's going on chemically with the dopamine and brain stuff. Oxytocin is a bonding chemical given off between mother and a child during nursing. It's also given off during sex between two people. Okay. Self-worth, area number three. I want to know, do they um, like themselves? Do they not? Confidence. Is there codependency issues? Are they relying on others to pour into them? And I even like to, at the end of the session, I'll look the men in the eye, or even when they come into my office, and just say, shake their hand, look in the eye, and say, "You are a good man." Okay. The women, again, as a man, I don't compliment their physical beauty. I do compliment them, acknowledging their courage, that you are an amazing woman. Um, if you're a woman, you definitely could compliment their physical beauty. As a man, I do not. Okay. And is a high, medium, or low, their self-worth, confidence, or what I call godfidence. Godfidence. What do they like, love, appreciate about themselves? And that's one of the homeworks I give at the end of the session, which we'll get to here in a little bit. All right. So, area number four, I'm looking for anger issues, mood, anxiety, depression, bipolar type stuff, mood irregulation, irregularities, and anger problems, violence, physical violence. Sometimes reading couples history of, have the cops been called? due to you guys being physical with each other. Okay. I also want to know in fantasy types, which section 5, heterosexual, homosexual or LGBTQ type stuff, same-sex attraction. I have to clarify is different in my experience than homosexual attraction. I used to do same-sex attraction groups for years. There's a lot of married men that are married to women but act out sexually with men. Okay. And again, that's the conditioning of the brain stuff. Okay. Um, child or minors, that sort of thing. Also, sometimes this is reportable. As a professional, you are going to have to report to your local authorities as a mandatory reporter child abuse. Okay. And that's also one of my lines after they sign my forms. They come into my office, we shut the door, and I verbally go over the form in a couple areas. What you share with me, I talk about the limits of confidentiality. Okay. So if you want to hurt yourself or others, I have to break confidentiality. If you're harming an elderly person or a minor, okay, I have to break confidentiality. And hoarding, and then since 9/11, hoarding of hazardous materials. Okay, and that's all in my disclosure paperwork that they sign off before we get started. But I find it very beneficial to share it again verbally. Okay. And on occasion, I would say once or twice a year, I have to make that call and report. And it's not just adults, sometimes it's children with children. Okay. And our job is not to decipher if it's abuse or the age difference is far enough or close enough. Always on there on the side of sharing the burden. Okay. Let the people that do the investigating do their job. I'm just a reporter. Okay. And I'm very upfront. And on occasion, I don't like doing it, but I have to make that call. Okay. And it's not just, sometimes it's out of state, another country, sometimes you got to make that call. Okay. Be resourceful, but you don't don't be that therapist, that helper, that professional or layperson that didn't report, because I've had to report. And well, who did you see? Okay, they didn't report this. No. Okay, now I gotta share that. Okay. Number 6, sexual positions, dominant, submissive. Again, that generally can, why are we asking this? Because it oftentimes is attached to the trauma or abuse. Okay, so as a child, little boy, little girl, were they dominated? Okay, and so sex becomes love, love becomes sex, wiring in their brain, even though it's abuse. Okay, so as they become adults, they now consciously, subconsciously choose to be dominated, to feel loved. Okay. Okay. Being submissive or being dominant. Okay. Area number 7, themes of fantasy preferences. So, and with pornography, especially, is there a nationality, body type, hair color, age you prefer? Okay. And some of these questions, again, you may want to ask, especially the addict without their partner present. Sometimes it's not a big deal. Oral, vaginal, anal, or violent type of sex acts. Have your fantasy changed in the last 2 months, 2 years, 30 days? Okay. We're looking for patterns. Mood, are you even keeled, depressed, up and down? Do you have more up days than down days? Because the reason I ask that is you begin to talk about. We don't talk a lot about this in mental health, this cyclothymic and dysthymic disorder. So dysthymic is you have more down days than up, generally 7 to 14 days apart. So it's kind of like a heartbeat monitor. And those peaks, my up days are 7 to 14 days apart. Okay. Right. Or am I cyclothymic? I'm more up than I'm down. Okay, more up days and then a down day, up day and then a down day. That can be an indicator of a chemical imbalance. Okay. To all my clients, I'm not a big pill pusher, but I have seen medication help tremendously. So always look at all areas. Okay. And so it's a mild form of depression. It's a mild form of bipolar disorder. Okay. Area number 9, counseling and recovery. So again, I am looking at how many therapists have they worked with, psychologists, groups, as an individual, as a couple. Okay, most recent, how long, how often, was it helpful? What was helpful about it? Recovery support groups for what issues? And again, it's not always addiction. It can be grief, loss, hoarding, just parenting, MOPS groups, whatever. Inpatient or outpatient, how many, last time, was it successfully completed? Okay. Just ask a lot of questions. Psychiatric medication history. So, ever been diagnosed with a mood disorder or personality disorder? Some people will say, well, I'm OCD. Well, have you been diagnosed OCD? Well, no. So a lot of people will kind of self-diagnose things. So you ask, well, who diagnosed you with that? Medication history, can list them, the generic, the brand names, current or past, helpful or harmful. Well, I liked it, I didn't like it, didn't notice much difference. Yeah, if you see Xanax, and that's a big one I learned working with psychiatrists for years. It's basically powdered alcohol. So if you hear Xanax, big red flag, and they're drinking, it's just powdered alcohol. Oh, my doctor gave it for anxiety. Yeah, he did. And some people, it can be addictive. Um, Other people, I use it, maybe once a year, once a month. Ever been hospitalized for mental health issues or suicide attempts? You're gonna write that. Ages, how long were you committed? Okay, what was the outcome? Medical history, surgeries, head injuries, diabetes, thyroid issues, concussions, looking for just patterns again. Okay, trying to connect the dots. How this person got here, the story, how it's connected, themes. Okay. Area number 11, intimacy, anorexia assessment, the aversion, the avoidance stuff. So you're ID and ruling out anorexia for the client, also the reactive anorexic for the spouse, the partner. If either scores 5 or more, IA is present. Okay. And again, most will come to you because of the acting out before the acting in stuff. Okay, but it's you act in long enough, you're going to medicate and act out with drugs, sex, and alcohol. So the deeper issue is the intimacy anorexia. The deeper issue with that is oftentimes the complex PTSD stuff. Okay. And the trauma, the neglect. 12, depression assessment. Each answers for themselves. If either is 5 or more, then depression is present. And again, I tell them I'm not a big pill pusher. Let's look at your food, your diet, see what's going on. Now here, I also like to clarify, once the acting out with sex addiction stops and the depression goes away, we then know it's the addiction or the pornography, okay, or the sexual acting out. If that stops and the depression continues or gets worse, then we know there might be a chemical imbalance. Okay. It's important to know. 13, married, or my partner. Sex section here. How often do you have sex with your partner? Do you ever go into fantasy during sex? Again, we're looking for dissociation. Are they really into more their fantasy man or woman more than their partner who initiates sex? Okay. And I have whole tools. We'll get into level 3 of how to begin to retrain their brains to glue to each other. Luckily, again, the brain has plasticity. There is hope, very retrainable. We can reprogram ourselves to each other. Are you happy with this, the sex life? Who's initiating, who's not, frequency, all that. All right, so we're looking back. Sexual history again. This is more for a female. We call her Mary, and she was first unwanted touch at 7 or 8 by the neighbor. Okay, hand, oral 3 times, never told anybody. And okay, what sexual experience was your next one? And again, be empathetic, be patient, be compassionate. Sometimes this is new information to the partner who's sitting there. Okay. 15 was my next one. A male one night stand, vaginal alcohol was involved. Okay. 15 again later we were together for a year. 16 to 17, he was 17, dating 2 years, 19 to 21. And sometimes you're not gonna be like, I don't know, there's so many I don't remember. So I'll start with, okay, when did you meet your husband, Bill? Okay, Mary's married to Joe right now, let's say. And so I'll do the 2 marriages. Okay, even how long did you date before getting married? Did you live together? These types of things. So then I'll get the big things, and I'll go back. Okay, between 15 and when you first got married, 21, how many partners? Maybe a dozen. Okay, don't need to get everybody's name. Sometimes it's too much. Okay, but get an approximate number. Let's see here. Then other behaviors not mentioned. No, I can't think of anything else. Behaviors of the same gender. And behaviors with this not mentioned, I'll ask things like, have you ever been in trouble with the law, DUIs, exposing yourself in public? Okay, I'll also ask any history of pornography. By then we already know, but I'll get more specific with dating sites or services, Craigslist and back in the day. Things like strip clubs, bookstores, peep shows, massage parlors. Okay. So again, that's part of my script and getting all that out, asking lots and lots of questions. Okay. Never, never, never underestimate alcohol. I've shared this before. I'll share it again. Alcohol does not help this process, a little or a lot. Just does not help this process if your couple is going to commit to doing especially intensive work. Okay. I've lost clients confronting them, and after the consultation, they don't come back. Okay, they're not ready. But alcohol is a big one. Any HIV or STDs, generally those are going to be no, surprisingly. Sometimes it'll be present. Oh yeah, I got an STD because my husband was acting out, and that's how we found out. All right, abortions again at the age of 25. Some will have many. Okay, and we'll get into level 3 on dealing with those abortions and the grief and loss, sometimes shame, guilt. And it's not just the women, the men can have tremendous amount of grief and loss, sometimes more than the women. Okay. And we have a tool to help either of them, both of them, heal from that. Okay. And no, it's not about pro-life or pro-choice, not getting into an egoic conversation there. So we're bringing it all together. So now we're going to start circling or underlining. Okay, so maybe they left, or you can even do this while they're there. Diagnostic impression, mood disorders. So there's anxiety. Is it that, or am I going to rule it out? Meaning it's there, but only as some of the features, not enough. Bipolar. If you have, especially the men, it can be bipolar, a lot of hypersexuality, a lot of partners, a lot of prostitution, massage parlors, big red flag that bipolar might be present. Okay. Cyclothymic, again, more up than down, or dysthymic, more down than up, can be a pre-indicator of some mild bipolar stuff and depression or anything else you can write in there. Okay. And now on looking at antisocial, the things borderline, these should be personality disorders. Dependent, obsessive compulsive, narcissism, schizoid, schizoaffective type stuff. Okay. Now schizoid, I haven't gotten a lot into, but if you're anorexic, male or female, scoring 8, 7, 8, 9, 10, high, generally schizoid might be present. Now, schizoid isn't schizophrenia, it's someone with a very flat affect. They don't smile much, very flat. Okay. They don't have a lot of friends. Okay. Outside of first degree family. Okay. They don't have a lot of social activities. Okay. They do a lot of things themselves. They might be more in techie professions. Okay. They're very, very asocial. Okay. And again, that you're going to see that. And now you got another layer of explaining where that anorexia comes from. Okay. All right. That's schizoid. Okay. So read up on that. A lot higher on the anorexia scale. Generally, the more likely schizoid, asocial, is present, doesn't like to have sex with other people. Okay, check that out in the DSM. Bringing it together. So psychological, again, the mother, father. So I'm going through circling for each person. Okay. A mother father wound, does it ring the bell, feed the dog, view the porn, masturbate? Is there trauma? Is there spiritual, meaning they don't have much spirituality or maybe too much? Okay. There is one intimacy anorexic, the offended heart, the emotional stuff, same-sex attraction, reactive anorexic, non-sex addict, sex addict, love addict. Okay, more of the love addiction. Okay, we explain that in level 1, more about the relationship than about sex, but always in a relationship. Okay, opportunist, always looking for the next exciting partner. It's all about sex. Okay, doesn't matter who, when, where. That's generally an opportunist. Drug and alcohol dependence, yes, no, strong, weak, mood disorders, and then personality disorders. So I am at the end of the session covering this, giving them, this is what I'm seeing. I always preface it, don't believe anything Corey says, seek the truth for yourself. Okay. And the last, well, what do we do? And I always say, well, depends how much pain you're in or how much a priority it is for you to make some changes. Okay. And that's in where I'll recommend a 3, a 5, a 10-day intensive. And why? Generally, the more trauma, the more likely more towards the 10-day or a 5-day if intimacy, anorexia, and addiction is present. Generally, it's a 5-day. Okay. And so for homework, talents, abilities, and gifts, I want you to bring a list of what you like, love, appreciate about yourself inside and out. Okay. What do you see professionally, personally, character qualities, musical talent, artistic abilities? Okay. Some people can't list anything. They'll come back with a blank sheet of paper. Some people struggle, but they go through it, and some people do this fairly well. Okay. Do some anger letters sometimes, start doing anger work, reading recommendations, journaling, attending a local group or any of our groups. Rubber band is sometimes give them both a rubber band that session or the next. Put on your wrist, and you want to snap your wrist when you have a thought of wanting to act out, okay? Or you're having a negative thought, being offended and anorexic about your partner. And then schedule the next session or intensive work. So we'll go through other treatment options, groups we have, books, resources. You can DIY it or do nothing. So I give them, lay out all these options. Okay, so there they are, 3 5-day intensive as a couple or as an individual, support groups we have, resources, blogs, books, themes we observed, severity of the issue sometimes. How bad is it, doc? 7, 8, 9, 10 being the most severe. Okay. What's next? Well, how much pain are you in? How much priority is for you to make some changes, schedule the next session, and other notables, meaning notes you might want to write down that don't fit anywhere else on the assessment sheet. Okay, or things you just want to remember. All right. All right, I think that was it. I think those are extra slides. So we're gonna end. Yeah, there. 20 was the notables. So appreciate your time. Hopefully that review makes it a little more clear. And always email, call us if you're struggling, have questions. Always happy to help. And next, we are going to get into tools. Tools. All right. We will talk to you later.